Imagine getting Botox injections at your local med spa and ending up looking like this. Well, what you're seeing is our guest Whitney's eye after injections gone wrong. She joins us now with her story. Welcome to the show, Whitney.
Hi. Hi, thank you so much for having me.
So tell us, how long did it take before your eye finally got back to normal?
I would say it took about 4 months to go back to totally normal. I started seeing improvement after about a month, but to be 100%, it was over 4 months.
So take us back, walk us through this. How did it get like that in the first place?
So it started with just a routine Botox appointment. So I typically go about twice a year and focus on my forehead lines and the 11 lines in between my eyes. So I went in for that appointment, and a few days later I noticed that my left eyebrow was a little bit lower than my right eyebrow. So I went back to my injector to have that fixed, and she added 4 units right below my brow on my left eye. And then about 5 to 6 days after that is when I started to notice that my eyelid was drooping on my left eye.
And I have seen this, I have heard this many, many times. What happened was they went outside these magical lines, the lines of your pupil, and if you go beyond that, you put dropping your brow at risk. So your brow dropped more on one side. They then went back to try to raise the brow by blocking the muscle that pulls the brow down and closes the eye. What happened? They got into that muscle that specifically lifts that upper eyelid, and a really odd, crazy appearance that would freak out anybody. What did you say to your injector when you went back to the med spa and they took a look at this?
So I had texted my injector with photos, and she had suggested doing a PDO thread lift on my left brow, which after speaking with doctors later after I spoke with her, they said definitely do not do that, because once the Botox wears off, you're going to have uneven brows because one will have a thread lift and the other will not. So I didn't do that. And then I spoke with the board certified plastic surgeon from the med spa. He referred me to a nurse practitioner who is one of the lead trainers and injectors in the area. And that's when she administered 2 units to my lash line to help open up that eyelid.
Unlike the fillers that we use that contain HA, with Botox, there's no way to reverse what has transpired. In other words, what you've injected is there. The only thing you can do is wait it out. Yes, you can try to inject in another spot to counterbalance the effect of what doesn't look right, but that may create a bigger problem that you keep chasing your tail and make the situation worse. You know, to your point, Whitney, that this provider wanted to immediately put in threads while you were having issues of asymmetry with Botox would have been the worst thing to do, because ultimately things did even out, and that is the right recommendation in that case. So one of the big issues here is right now the neuromodulators are approved to take care of those wrinkles you alluded to, your goalposts, your 11s, and your forehead lines. Injecting other parts of your face are what we call off-label usages, and when you start trying to change something with eye position or your lips or the shape of your mouth or your smile, there you're setting yourself up to really get things that look unnatural and asymmetrical. In cases like that, you only want to be touched by somebody who really is an expert in injections. I mean, I know a lot of non-physicians and non-plastic surgeons, dermatologists are getting into injections. I'm not saying they can't do it, but just be very careful on who you choose to do it. Thank goodness, Whitney, you look as great as you do now. You had to wait it out, but you did the right thing. Thanks for joining us.
Yeah, thank you so much for having me.
All right, a pleasure.